This morning we talked with Minority Whip Steny Hoyer from Maryland. It's nice to see you, sir. Thanks for talking with us. As we've been telling people, Jeff Toobin, who was on our air just a few minutes ago as well, said, listen, this was a train wreck. Even from the opening statements, it seemed disorganized. It seemed like there was a lot of stumbling. Would you describe it that way, this presentation, as opening arguments as a train wreck?
One of my top staffers who worked on this bill and who's very knowledgeable about this issue indicates that there was a rough start, but that both Justice Roberts and Justice Kennedy at the end were asking questions of the other side that seemed to reflect a fairness of view. Now, we'll see whether that's the case, but the case isn't over until it's over, and the justices are going to have to reflect upon the issues here, and they'll meet in joint session with one another and discuss it. So I think it's way too early to say that it was a train wreck or that this case is over. I think this matter will be resolved, that the mandate is in fact constitutional, and this bill will go forward.
So what are the political implications? Because ultimately I think that's what a lot of people are examining for either option. Either it's constitutional or it's ruled unconstitutional. If it's ruled constitutional, what are the political implications? And if it's ruled unconstitutional, what potentially are the political implications for President Obama and any kind of re-election campaign?
Well, of course, Soledad, there are an awful lot of portions of this bill that are very popular with the American people. Clearly, they like the fact that their children or themselves can't be precluded for pre-existing conditions. They like the fact that young people between the ages of 22 and 26 that can't find insurance can stay on their policies. They certainly like the fact, seniors, that their prescription drug costs are going down. So there are a lot of component parts, and when you say unconstitutional, will they find the mandate unconstitutional, the balance of the bill okay? Do they work together and therefore the whole thing falls? We don't know the answer to that question, but I think, frankly, there is no doubt that there's a problem. The problem is making sure that 30 to 50 million Americans have access to affordable quality health care. We think the bill that was passed, signed into law, does that. And we frankly haven't heard any alternatives from Republicans or others on how to get that done. But everybody agrees that objective is one that needs to be accomplished. So I'll see what the ramifications will be after the court makes its decision.
John?
Good morning, Congressman. You mentioned some of the positive aspects of the bill, from eliminating pre-existing conditions to allowing people to be covered under their parents' insurance until age 26, which has motivated a lot of businesses to hire young people. The problem progressives have had with this bill from the beginning is that they don't like the mandate. They see it as a conservative idea that the Democratic Party adopted for this bill. Is there a concern that the Supreme Court, if striking this down, will dispense with all the good things of the bill, or do you think there's a chance that only the mandate may be struck down and the elements that Americans of both political stripes favor may still survive?
Well, I don't know the answer to that question, and I think experts don't know the answer to that question at this point in time. Clearly, we believed, and it's ironic that as you point out, that the mandate was a conservative idea on how you get people involved in the insurance pool to spread the risk and bring costs down. That clearly is the objective, and it's ironic that now the conservatives that came up with this idea are so vigorously attacking it. Largely because I think it was a Democratic idea, what they perceive as a democratically sponsored piece of legislation. But I don't really think we know the answer to whether we can keep the good stuff and lose the bad stuff, because the bad stuff being, from people's perspective, the mandate. What we're saying is, look, everybody has to be included in the risk pool. Otherwise, you don't bring the price down. If you don't bring the price down, neither government, business, nor individuals are going to be able to afford having health insurance. And if that's the case, our society won't be as healthy and our people won't be as protected.
Well, Congressman Hoyer, Will Cain here. I want to shift directions if I can for one moment. You guys, the House Democrats, just yesterday put out your budget proposal for the coming years. In it, you put out a proposal that doesn't really touch on Medicaid and Medicare. And I want to ask you this, and most people watching know I come from a conservative perspective, but just from a sense of honesty, look, Medicare, Medicaid, and Social Security take up 40+% of the budget, and in a 30, 40-year time span, most people project it'll take up 100% of our tax revenues. Is it really possible to reform our budget, to achieve a balanced budget, without touching these programs?
No, I think that, as you may have known, I've given a number of speeches on the fact that and Chris Van Hollen has been very involved in this as well. We need to solve our budget deficit and debt problem by a balanced package that reflects something along the Bowles-Simpson, Domenici-Rivlin, Gang of Six proposals where everything is on the table, everything needs to be addressed. What we don't need to do is what the Republican budget does and what our budget does not do, not destroy the guarantee that Medicare, in fact, will be available. Yes, do we need to make sure it's fiscally sustainable? Absolutely. Do we need to, however, put at risk the receipt of Medicare and the insurance of Medicare for our seniors and others? The answer to that is an emphatic no. Our budget that we put forward is a balanced package. It's very much like the president's package, balanced in terms of revenues, cuts, and moving forward to reduce the deficit. Very frankly, the alternative budget offered by the Republicans today and tomorrow is not balanced. It will not bring down our deficit in the foreseeable future, and the cuts that it proposes simply shift from the middle class and the poor the burdens to them and the wealth to the wealthiest in America. That's not a fair program. That's not a balanced program. It's not a program that we think will get us from where we need to be, where we are, to where we need to be. And in fact, in the Republican budget, there are no specifics. And they're very unrealistic in terms of the cuts that can be affected, and exceedingly unrealistic in terms of the $10 trillion in revenue cuts that they suggest can be offset with the elimination of preference items that they refer to generally, but not specifically. They don't take on the hard questions.
Minority Whip Steny Hoyer joining us this morning. Thank you, sir. We appreciate your time.
You bet.
Starting Point's back in a moment. Stay with us.